Are you still recovering but don't know what to do next? Do you want a safe way to move and to heal? The navigation of ruin is my story, how I went from losing everything to having the wonderful life I have now. Let this archive show you how to handle yoga, post-surgery, and beyond. Incidentally, this program was adapted from an Arthritis for Seniors program that I taught, and it's really good for relieving pain and stiffness in the hands. Such a good cat. Relax in a comfortable seated position. Shake it out a little. Do a cleansing breath, inhaling through the nose and exhaling with a big ha. Let's begin by flicking water off our fingers. Just imagine that your hands are wet and you're flicking the drops of water off the tips of your fingers. And then you're going to grasp with your fingers like you're grasping something out of the air. Now imagine your hands are cat claws, and you're going to curl your fingers and scratch. Then you're going to place your hands onto your lap so that the palms are on your lap, and then try and lift your fingers up from your lap. And keeping those palms on your lap, you're going to curl your fingers under. Imagine you're playing a piano, and with each finger, you could do a little gentle twist as you do this, or you could just remain stationary and try and move each and every finger sequentially. Now turn your palm so it's facing outward. Grab the inside part of your hand and just gently roll it. Of course, you want to do the other hand. And if you want to try a flexibility exercise, put the backs of your hands together and see if you could touch your thumbs. You might not be able to do anything but this now, but if you keep just sort of rolling it back and forth, you can eventually get it so it touches. I like to shake out my hands after some of these exercises to kind of increase circulation and to relieve tension. Also, I like to do Star Trek. So if you want to increase your flexibility and your coordination, you can start off with one hand, your dominant hand, open out the thumb, And then just go down the fingers. Take your time. Go slow. Other hand. And again, shake it out. And again, if you want to try the challenge, you're going to do both hands at the same time. This coordination exercise, you place both hands onto your lap and you're going to flip it over and then place it back down. Then try and do both hands at once. And if you want to try the extra challenge, put one hand up and the other hand down and then flip them. My oncology team provided me with this little gem. It's kind of a squishy ball, and it helps to increase the strength in your hands and to rebuild nerves that might have been damaged during surgery. If you don't have one of these squishy balls, you can use a tennis ball, but it's not quite as good because it doesn't squish, but it's great in a pinch. I did both sides. But if you just want to do the side where you had the surgery, feel free to do that. Sometimes I do both hands at once to save time. Okay, so the first thing you do is with your palm up, you're going to squeeze the ball 3 to 5 times. And then with the palm down, you're going to do the same thing. Then you're going to lift up the wrist and lower it down. Lift it up, lower, lift it up, and then lower. Also, too, you're going to roll your wrists, or wrist. It depends on what kind of challenge you want on any particular day. Roll it in one direction and then roll it in the opposite direction. You could do one hand at a time if you want to. Or you could do both hands at the same time. I also liked to practice these Tai Chi hand movements. It's not exactly a sequence of Tai Chi, but it's very reminiscent of the movements that you would make with Tai Chi. It's letting your hands and wrists flow, allowing your fingers to be loose. Making circular motions. Remember, if you still have your draining, keep your elbows lower than your shoulders. Another great practice to do is hand massage. One of the ways to massage your hands is to just simply rub one hand with the other. Some people like light, gentle movements. Some like to do more vigorous massages. You could use your thumb or your fingers. One of the things I like to do is I like to hook my fingers together and then to take my thumbs and run it along the pad of the thumb. I don't know if you can see this, but it's one of my favorites. Also too, if you're dealing with any lymphedema, you can also do the gentle stroking. Another way to do hand massage is to take a little ball and just roll it between your hands. This is a racquetball ball, and that also feels really good. I have this little wood massager thing, and that the rollers on this massager also work very well. Arthur. Arthur, you are the kitten. Ugh. Oh my God. You're so heavy. You're so heavy. Oh, Arthur, Arthur, Arthur. You are the kitten.